What is the difference between dementia and Alzheimer's? What can you do to prevent it? The two things are not exclusively different. Alzheimer's is a type of dementia that is a more specific diagnosis. The vast majority of the time, it doesn't mean anything clinically as far as how the patient's going to act and how you're going to, as a caregiver, maybe, or taking care of them, or as a person with the diagnosis, how you're going to be. You're going to have, symptoms where you may have usually decreased short-term memory. You might not be able to remember what you had for breakfast this morning, but you can tell eloquently what you had at your birthday dinner 20 years ago and who was there and what they were wearing, etc. It is amazing how this works. You can sometimes forget certain things with dementia, like eating. You think you've eaten, think you've taken your medications, and you haven't, and you remember, and then you take it, or you did take it, but you didn't remember that you took it, and you took another dose, and now you got too much medicines in. So various types and levels of dementia. It may be something that I can't find my car in the parking lot when I went to the mall, or I walk out the house at night because I can't remember where I'm at, and now I don't remember how to get home because I'm just walking in the neighborhood, or you're around people, you're even family, children, you don't recognize them. They don't recognize, well, they recognize you, but you don't recognize them. Or you may recognize one person, or you don't recognize the other person. And so that, there are various levels of dementia. There is no substantive effective treatment for dementia. They are looking for dementia. The medications that they have now are said to slow the rate of deterioration. How that is measured, I have no idea. As a scientist, you cannot have a good outcome when I don't know what the starting point is, and I don't know what the end point would have been. I'm just saying, okay, you're not as bad as you would have been if you weren't taking the medication. That is, medical gobbledygook. So most people that start on the medication, everybody thinks it's wonderful. I explain to my patients when they bring in usually a parent that has dementia, I say, look, grandmother, grandfather is going to take this medicine. They're not going to be balancing the checkbook next week. That is gone. That will never come back. The objective is to make sure that they are functional and not a danger to themselves or others. But we continue to look. The amount of research that's been done in Alzheimer's in the last 20 years, all focused on plaques in your brain. The problem is the plaques don't seem to be the problem. They have created drugs that will stop the plaque formation, but now we are beginning to think that maybe the plaques are protective and that they are protecting the nerves in the brain from attack by a virus, thought to be possibly the Epstein-Barr virus, thought to be possibly the herpes virus, or a virus that we have not identified, but the signs and symptoms are significant and substantial and appear to be viral in nature. So that's where we are with that.